Hi, good morning.
I'm Klein.
I'm Martin.
I'm Jessa.
I'm Mervin.
I'm Brian.
I'm Mark.
I'm Hitch.
I'm Claudia.
I'm Amber.
And we are the Group 5.
We are here to present about basic life support and first aid.
And common condition that requires medical care.
With their definitions, signs and symptoms, necessary interventions, and emergencies.
Among these conditions are
Choking, seizures,
Heat-related illnesses such as heat exhaustion and heat stroke.
lacerations, or wound fractures.
Hyperplexia and shock.
We aim that, with the making and compilation of this video, we could further enlighten you about the basic life support and the first aid.
Basic life support
Is a level of medical care which is used for patients with life-threatening illnesses or injuries until the patient can be given full medical care at a hospital. It can be provided by a trained medical personnel, including the emergency medical technicians, paramedics, and by the laypersons who have been received BLS training, and bio-life support is generally used in the pre-hospital setting and can be provided without medical equipment. ABCs of a basic life support. Airway. The protection of maintenance of a clear passageway for gases, principally oxygen and carbon dioxide, to pass between the lungs and the outside of the body. Breathing. Inflation and deflation of lungs, respiration via airway. Circulation, providing an adequate blood supply to the body, especially critical organs, so as to deliver oxygen to all cells and remove carbon dioxide via perfusion of blood throughout the body. Advanced life support is a set of life-saving protocols and skills that extend basic life support to further support that circulation and provide an open airway and adequate ventilation. First aid is the provision of initial care for an illness or injury. It is usually performed by a non-expert person to a sick or injured person until definitive medical treatment can be accessed. 3 key points in first aid. Preserves life. The overriding aim of all medical care includes first aid is to save lives. Prevent further harm, also sometimes called prevent the condition from worsening or danger of further injury. This covers both external factors such as moving patient away from any cause of harm and applying first aid techniques to prevent worsening of the condition. Promote recovery. First aid also involves trying to start the recovery process from the illness or injury, and in some cases might involve completing a treatment, or such as the case of applying a plaster to a small wound. First aid kits, stock supplies that can save lives. Basic supplies are adhesive tape, antibiotic ointment, antiseptic solution or towelettes, and etc. By the medications, activate charcoal. Use it only if instructed by a person control center. Aloe vera gel, anti-diarrhea medication, and etc. Emergency items, cell phone and charger that uses the accessory plug into your car dash. Emergency phone numbers, including contact information for your family doctor and pediatrician, local emergency services, emergency road services, providers, and the regional poison control center, and etc. Cardiopulmonary resuscitation is a life-saving technique useful in many emergencies, including heart attack or near droning, in which someone's breathing or heartbeat has stopped. In 2010, the American Heart Association updated its guidelines to recommend that everyone, untrained bystanders and medical personnel alike, begin CPR with chest compressions. It's far better to do something than doing nothing at all. CPR can keep oxygenated blood flowing to the brain and other vital organs until more definitive medical treatment can restore normal heart rhythm. When the heart stops, the absence of oxygenated blood can cause irreparable brain damage in only a few minutes.
Before starting CPR, check: is the person conscious or unconscious? If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person doesn't respond and two people are available, one should call the local emergency number and one should begin CPR. Remember to spell CAB. Circulation. Restore blood circulation with chest compressions. Put the person on his or her back on a firm surface. Kneel next to the person's neck and shoulders. Place the heel of one hand over the center of the person's chest between the nipples. Place your other hand on top of the first hand. Use your upper body weight as you push straight down on the chest at least 2 inches. Push hard at a rate of about 100 compressions a minute. Airway. Clear the airway. If you are trained in CPR and you've performed 30 chest compressions, open the person's airway using the held tilt, chin lift maneuver. Check for normal breathing, taking no more than 5 or 10 seconds. Look for chest motions, listen for normal breath sounds, and feel for the person's breath on your cheek and ear. Breathing. Breathe for the person. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing if the mouth is seriously injured or cannot be opened. With the airway open, pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. Prepare to give 2 rescue breaths. Give the first rescue breath and watch to see if the chest rises. If it does rise, give the second breath. If the chest doesn't rise, repeat the held tilt chin lift maneuver and then give the second breath. Resume chest compressions to restore circulation. Continue CPR until there are signs of movement or emergency medical personnel take over. Most cardiac arrests in babies occur from lack of oxygen, such as from drowning or choking. If you know the baby has an airway obstruction, perform first aid for choking. If you don't know why the baby isn't breathing, perform CPR. To begin, examine the situation. Stroke the baby and watch for a response such as movement, but don't shake the baby. If there is no response, follow the CAB procedures and time the call for help as follows. If you're the only rescuer and CPR is needed, do CPR for 2 minutes, about 5 cycles, before calling your local emergency number. If another person is available, have that person call for help immediately while you attend to the baby. The procedure for giving CPR to a child aged 1 through 8 years old is essentially the same as that for an adult. The differences are as follows. If you're alone, perform 5 cycles of compressions and breaths on the child. This should take about 2 minutes before calling your local emergency number or using an automatic external defibrillator. Use only one hand to perform heart compressions. Breathe more gently. Use the same compression breath rate as is used for adults. 30 compressions followed by 2 breaths. This is 1 cycle. Following the 2 breaths, immediately begin the next cycle of compressions and breaths. After 5 cycles, or about 2 minutes of CPR, if there is no response and an automatic external defibrillator is available, apply it and follow the prompts. Use pediatric pads if available. If pediatric pads aren't available, use adult pads. Continue until a child moves or help arrives. Common conditions that require first aid and basic life support.
Choking occurs when a foreign object becomes lodged in the throat or windpipe, blocking the flow of air. In adults, a piece of food often is the culprit because choking cuts off oxygen to the brain. Administer first aid as quickly as possible. The universal sign for choking is hands clutched to the throat. If the person doesn't give the signal, look for this: inability to talk, difficulty breathing or noisy breathing, inability to cough forcefully, skin, lips, and nails turning blue or dusky, loss of consciousness. If choking is occurring, a 5 and 5 approach is recommended to deliver first aid. To perform abdominal thrust, Stand behind the person. Wrap your arms around the waist. Tip the person forward slightly. Make a fist with one hand. Position it slightly above the person's navel. Grasp the fist with the other hand. Press hard into the abdomen with a quick upward thrust, as if trying to lift the person up. Perform a total of 5 abdominal thrusts if needed. Perform a total of 5 abdominal thrusts if needed. If the blockage still isn't dislodged, repeat the 5 and 5 cycle.
Seizures are malfunctional in electrical activity in the brain. 3 types of seizures includes a grand mal, which usually picture convulsion as well as temporary respiratory abnormalities, change in skin, complexion, etc., and petit mal, which usually pictured twitching, rapid blinking, or fidgeting as well altered consciousness and temporary respiratory abnormalities. An epileptic seizure, usually referred as the fit, is defined as a transient symptom of abnormal, excessive, or synchronous neural activity in the brain. There are a few things you can do to help someone who is having seizures of any kind. Number 1, stay calm. 2, prevent injury. 3, during seizures, you can exercise your common sense by ensuring there's nothing within reach that could harm the person struck in. 4, pay attention to the length of the seizure. 5, make the person as comfortable as possible. 6, keep onlooker away. 7, do not hold the person down. 8, if the person is having seizure, trashes around there is no need for you to retain them. Remember to consider your safety as well. 9, do not put anything in the person's mouth. 10, contrary to the popular belief, a person having seizure is incapable of swallowing their tongue, so you can breathe easy into the knowledge that you can do not have to stick your finger into the mouth of someone who's in condition. 11, do not give the person water, pills, or food until fully alert. 12, if the seizure continues for the longer than 15 minutes, call 911. 13, be sensitive and supportive and ask others to do the same. After seizure, the person should be placed on their left side. Keep in mind, there's a small risk of post-seizure vomiting. Before the person is fully alert, therefore, the person's head should be turned so that any vomit will drain out the mouth. Without being inhaled, stay with the person until she recovered 5 to 20 minutes.
Heat-related illnesses. Heat exhaustion is one of the heat-related syndromes which range in severity from mild heat cramps to heat exhaustion to potentially life-threatening heat strokes. Heat cramps are painful, involuntary muscle spasms that usually occur during heavy exercise in hot environments. Heat stroke is the most severe of the heat-related problems, often resulting from exercise or heavy work in hot environments combined with inadequate fluid intake. Signs and symptoms of these heat-related syndromes may be feeling faint or dizzy, nausea, heavy sweating, rapid weak heartbeat, low blood pressure, cool, moist, pale skin, low-grade fever, heat cramps, headache, fatigue, dark-colored urine, irritability, unconsciousness, and confusion. If you suspect these heat-related illnesses, get the person out of the sun and into a shady or air-conditioned location. Lay the person down and elevate the legs and feet slightly. Loosen or remove the person's clothing. Have the person drink cool water or other non-alcoholic beverage without caffeine. Cool the person by spraying or sponging him or her with cool water and fanning. Monitor the person carefully. Heat exhaustion can quickly become heat stroke. If fever greater than 102 Fahrenheit or 38.9 degrees Celsius, fainting, confusion, or seizures occur, call your emergency medical help or your emergency local number.
Burn is a type of injury to flesh caused by heat, electricity, chemical, light, radiation, or friction. The most burns only affect the skin, epidermal tissue, and dermis. Rarely furred tissues such as muscle, bone, and blood vessel can also be injured. The three burn classification of first-degree burn, second-degree burn, and third-degree burn will be helped to determine emergency care. First-degree burn. The least serious burn are those in which only the outer layers of skin is burned, but not also the way of truth. Second-degree burn. When the first layer of skin has been burned through and the second layer of skin is dermis, also is burned, and the injury is called the second-degree burn. The third-degree burn. The most serious burns involve all layers of skin and cause permanent tissue damage. Okay na. For minor burn, take the following action. Cold the burn. Hold the burn area under the cold, not cold running water for 10 to 15 minutes or until the pain subsides. If this is impractical, immerse the burn in cold water or cold with cold compression. Cooling the burn reduces swelling by conducting heavy away from the skin. Don't put ice on the burn. Cover the burn with sterilized gauze bandage. Don't use fluffy cotton or other materials that may get lint in the wound. Wrap and gauze loosen to avoid putting pressure on the burned skin. Bandaging keep air off a burn, reduce pain, and protect blistering skin.
Wound. A wound is a type of injury in which skin is torn, cut, or punctured, an open wound, or where blunt force trauma causes a contusion, a closed wound. In pathology, it is specifically refers to a sharp injury which damaged the dermis of the skin. Classification of wounds. Open wounds. Open wounds can be classified according to the object that caused the wound. The types of open wounds are incision or incised wounds, caused by a clean, sharp edge, open such as knife, a razor, or a glass splinter. Lacerations, irregular tear-like wounds caused by some blunt trauma. Laceration and incision may appear linear, regular, or oscillate irregular. Abrasions, graze, superficial wounds in which the topmost layer of the skin, the epidermis, is scraped off. Abrasions are often caused by a sliding fall onto the rough surface. Puncture wounds, caused by an object puncturing the skin, such as a nail or needle. Penetration wounds, caused by an object such as a knife entering and coming from the skin. Gunshot wounds, caused by a bullet or similar projectile driving into or through the body. There are maybe two wounds, one at the site of entry and one at the site of exit, generally referred to as a through and through. Close wounds. Close wounds have fewer categories, but are just as dangerous as open wounds. The type of close wounds are contusions, more commonly as the bruises, caused by a blunt force trauma that damaged tissue under the skin. Hematomas, also called a blood tumor, caused by a damage to a blood vessel. that in turn causes blood to collect under the skin. Cross injury, caused by a great or extreme amount of force applied over a long period of time. Chronic and acute. Acute or traumatic wounds are the results of injuries that disrupt the tissue. Chronic wounds are those that are caused by a relatively slow process that leads to tissue damage. Minor cuts and scrapes usually don't require a trip to the emergency room. Yet, proper care is essential to avoid infection or other complication. These are the guidelines can help you care for simple wounds. Number 1. Stop the bleeding. Minor cuts and scrapes usually stop bleeding on their own. If they don't, apply gently pressure with a clean cloth or bandage. Number 2. Clean the wound. Rinse out the wound with the clear water. Soap can irritate the wound, so try to keep out of the actual wound. If dirt or debris remains the wound, after washing, use tweezer, clean with alcohol to remove the particles. If debris still remains, see your doctor. Number 3. Apply an antibiotic. After you clean the wound, apply a thin layer of antibiotic cream or ointment to help keep the surface moist. The products don't make the wound heal faster, but they can discourage infection and help your body's natural healing process. Number 4. Cover the wound. Bandage can help keep the wound clean and keep harmful bacteria out. Number 5. Change the dressing. Change the dressing at least daily or whenever it becomes wet or dirty.
Number 6. Get stitches for deep wounds. A wound that is more than 1/4 inch, deep or gaping or jagged edge and has spot of muscle protruding usually requires stitches. Number 7. Watch for signs of infection. See your doctor if the wound isn't healing or you notice any redness, increasing pain, drainage, warmth, or swelling. Number 8. Get a tetanus shot. Doctor recommended you get a tetanus shot every 10 years. If your wound is deep or dirty and your last shot was more than 5 years ago, your doctor may recommend a tetanus shot booster. Get the booster as soon as possible after the injury.
A fracture is a broken bone. It requires medical attention. If the broken bone is a result of a major trauma or injury, call your local emergency number. Also call emergency help. Follow the following. The person is unresponsive, is breathing, or is moving. Begin the cardiopulmonary resuscitation (CPR) if there is no respiration or heartbeat. There is heavy bleeding. Even gentle pressure or movement cause pain. The limb or joint appears deformed. The bone has pierced the skin. The extremity or the injured arm or leg, such as toes or finger, is numb or bluish at the tip. You suspect a bone is broken in the neck, head, or back. You suspect a bone is broken in the hip, pelvis, or upper leg. For example, the legs and foot turn upward abnormally. Follow the following. Stop any bleeding. Apply pressure to the wound with sterile bandage, a clean cloth, or a clean pieces of clothing. Immobilize the injured area. Don't try to realign the bone or push a bone that is sticking out back. You've been trained in how to splint, and professional help is readily available. Apply a splint to the area above and below the fracture site. Padding the splints can help reduce discomfort.
Autonomic hyperreflexia is a reaction of the autonomic involuntary nervous system to overstimulation. This reaction may include high blood pressure, change in heart rate, skin color changes, paleness, redness, blue-gray skin color, and excessive sweating. Symptoms can include any or all of the following: anxiety or apprehension, bladder or bowel dysfunction, blurry vision, fainting, fever, flushing, skin turning red, goosebumps, heavy sweating, irregular heartbeat, lightheadedness or dizziness, muscle spasm, nasal congestion. Causes of hyperreflexia, spinal cord injury. In this condition, types of stimulation that are tolerated by healthy people create an excessive response from the person's nervous system. Other causes include medication side effects, use of illegal stimulants such as cocaine and amphetamine. Guillain-Barré syndrome, a severe form of paralysis that can lead to respiratory failure. Subarachnoid hemorrhage, a form of brain bleeding, severe head trauma, and other brain injuries. Call your healthcare provider if you have symptoms of autonomic hyperreflexia. Prevention. Prevention of autonomic hyperreflexia includes avoiding medications that cause this condition or make it worse. In people with spinal cord injury, the following may also help prevent this complication. Avoid letting the bladder become too full. Keep pain levels low. Practice proper bowel care to avoid stool impaction. Practice proper skin care to avoid bed sores and shock happens when your blood pressure is too low and not enough blood and oxygen can get to your organs and tissues. Shock often accompanies trauma. It is also known as circulatory collapse. Types of shock: hypovolemic shock caused by internal or external bleeding, septic shock caused by infections in the bloodstream, anaphylactic shock caused by severe allergic reaction, cardiogenic shock caused by the inability of the heart to pump blood effectively, neurogenic shock caused by extreme emotional upset due to personal tragedy or disaster. Causes of shock include internal or external bleeding, dehydration, burns or severe vomiting, and/or diarrhea. All of these involve the loss of large amounts of body fluids. Symptoms of shock include cold and sweaty skin, weak but rapid pulse, irregular breathing, dry mouth, dilated pupils, and reduced urine flow. Treatment of shock: do not let the casualty move unnecessarily. Eat, drink, or smoke. Do not leave the casualty unattended. Reassure the casualty constantly. Treat any cause of shock which can be remedied, such as external bleeding. Lay the casualty down, keeping the head low. Raise and support the casualty's legs. Be careful if suspecting a fracture. Loosen tight clothing, braces, straps, or belts in order to reduce constriction at the neck, chest, and waist. Insulate the casualty from cold, both above and below. Contact the emergency service. Check and record breathing, pulse, and level of response. Be prepared to resuscitate the casualty if necessary.